let's talk about stress urinary incontinence. Hi, my name is Dr. Alexandra Dubinskaya. I'm a urogynecologist and the founder of Los Angeles Institute for Pelvic and Sexual Health. Stress urinary incontinence is urinary leakage with physical activity, so anything that increases your abdominal pressure, like coughing, laughing, sneezing, jumping, or lifting anything heavy. This is a common condition, and there are some risk factors that predisposing women to develop stress urinary incontinence, such as obesity, getting older, pregnancy and childbirth, and also chronic medical conditions like coughing or connective tissue disorders. The truth is, you don't have to suffer with the leakage with physical activity, because there are a lot of things that can be done to improve the symptoms. First of all, the little trick that you can use, you can take a large tampon and insert it in the vagina. That tampon will compress the urethra and prevent the urine from coming out. So you can use that trick when you need to go for a run or play tennis. And obviously, it's not a perfect trick, and if you have a significant leakage, it won't help. But with a small leakage, it will definitely be very helpful. There is also a device called Impressa. You can get it at any pharmacy, and it's basically a fancier and more expensive large tampon that does the same. There is also pessaries, silicone devices that insert vaginally and compress the urethra, prevent the urinary leakage. You can also do pelvic floor physical therapy. So what are the other treatment options that can help more definitively with your stress urinary incontinence? There is urethral bulking. We place a cystoscope, which is a small tube with a camera in the end, and we inject the filler in the side wall of your urethra, the tube where you pee from. That filler basically bulks up the urethra and prevent urine from coming out. The good thing about this procedure is that it's quick, very well tolerated when it's done in an office, and there is literally zero downtime. One of the drawbacks of this procedure is that you will likely need to re-inject those fillers in the urethra at some point, maybe a year, maybe in 2. So what is the most definitive gold standard treatment for the stress urinary incontinence? It's a sling, mid-urethral sling. It's a small piece of the synthetic material that plays through the vagina and acts as a hammock that supports your urethra and prevents your urine from coming out whenever you're jumping, sneezing, or doing any activities that you enjoy. This procedure is done in operating room, but it's an outpatient procedure, meaning you do not need to spend the night in a hospital. It takes about half an hour to perform, and when you wake up, you can walk around, take a stairs, take a shower, eat whatever you would like. The only things that you shouldn't be doing is to lift anything heavy or insert anything in the vagina, including tampons or having sex. At 4 weeks after procedure, majority of women can go back to the normal routine physical activity and exercising, and they can start having sex again. As you can see, there are multiple options to treat stress urinary incontinence. So remember, you don't need to suffer with that. Make sure you talk to your urogynecologist and find the treatment option that most suitable for you.